Welcome, everyone. Apologies for having to hear us walk through our technical difficulties, but we are pleased to bring you this session of the California HPV Vaccination Learning Collaborative, brought to you today by the California HPV Vaccination Roundtable. My name is Shante Davis Patterson, and I am one of the coordinators of the California HPV Vaccination Roundtable. So we have muted everyone today, and if you want to ask a question, you could just unmute yourself. You can also drop questions in the chat box, and we are recording, as you noticed when you logged in. And then we will be dropping an evaluation link at the end of the webinar. We'd appreciate if you all would help us to evaluate our session. All right, so a quick icebreaker today. Please first drop your name, your organization, your role, your pronoun, and then something that you're looking forward to doing this spring. Spring has sprung, it is upon us. So let us know in the chat, and then we can also get an idea of who is joining us today on for this session. All right, so as I mentioned, this learning opportunity is being brought to you by the Engaging Health Systems and Providers Work Group of the California HPV Vaccination Roundtable. What is the roundtable? Just for those of you who may be joining us for the first time, excuse me, and may not be familiar with the roundtable, we're a coalition of diverse stakeholders with a mission to work together to prevent HPV-associated cancers and precancers by increasing vaccination rates to 80% by 2026. And then there's our website at the bottom, cahpvroundtable.org. Our agenda today, I just have a quick update from the roundtable, and then we'll jump into our presentation from the Gold Coast Health Plan, and then we'll do Q&A at the end, and we'll close. So one announcement from the California HPV Vaccination Roundtable, we are currently still offering the announcement approach trainings. These announcement approach trainings present strategies for recommending the HPV vaccination for the HPV vaccine to promote vaccine acceptance and save clinical time. The training is designed for providers and interacting with parents. You can learn the latest on the HPV vaccine research and guidelines, as well as brief evidence-based communication. It's a 1-hour online interactive training, and you can contact us to schedule a training if you're interested. It's a free training. We do it over Zoom, and we now have our CME credits available. We've been talking about how we've been trying to get these credits for the past year, and we finally have them. So if you and your health system, your team is interested in this training, please let us know, and we'll get you scheduled for this training. All right, so without further ado, I want to present our main presenter today. We have April Whetsell and Kayla Thompson from Gold Coast Health Plan. I'm going to turn it over to April and Kayla.
Hi, everyone. It's so nice to be here. Thank you for having us. I'm on my phone, so I can't see anybody. I also had technical issues. The same with Kayla. She's on her phone. So I apologize. Might be looking to my left to look at my slides, as it's very tiny on my phone. But we're happy. I see Kayla. Yay. Happy to be here, and we'll go ahead and get started. So we're going to be talking about our HPV vaccine member incentive program, and then other strategies that Gold Coast is doing around improving HPV vaccine rates. Next slide, please. So here's just a general overview slide just to give everyone an idea of where Gold Coast is. So we're in Ventura County. We serve roughly 244,249 lives. We have 3 large health systems and individual health network providers. And so looking at kind of our population who's on Medi-Cal, 1 in 2 children ages 0 to 5 are on Medi-Cal, 1 in 3 Ventura County residents, and 1 in 6 Ventura County seniors are on Medi-Cal. And then kind of just like one thing to point out here of our network provider, we have 525 primary care providers. Next slide, please. So we report and monitor the IMA measure, which I'm sure everyone, most everyone on this call is familiar with the IMA measure. It's adolescent immunizations, and part of that measure is we want our 9 to 13-year-olds to receive their HPV vaccine series on or before their 13th birthday. So we track that. And the graph here on the right shows our 6-year historic rate. Our measurement year 2024 rate is preliminary. We're still finalizing that rate. But I think the trend that all health plans see is that the Tdap and meningococcal vaccines do very well. Part of that has to do with the schools requiring them. And then the HPV vaccine underperforms. And that is the gray line here. Next slide, please. And so now I'll pass it to Kayla, and she will talk about our member incentive program.
Hi, everybody. I'm Kayla Thompson, QI Program Manager at Gold Coast Health Plan. So we're going to be going over a little bit about the HPV vaccine member incentive program. So members are eligible to get these gift cards in 2 different ways. So we have our in-house method where members will receive their gift cards by mail. And when they complete their service, they will mail or fax over their completed incentive forms over to Gold Coast. And then we have point of care members who are assigned to a clinic that is participating in the point of care gift card program are eligible to get their gift card at the clinic once they receive their vaccination. The little chart down below, you can see that HPV vaccine started on February 1st of 2024. It's for members ages 9 to 12 who received the 2nd dose of the HPV vaccine series on or before their 13th birthday. It is a $25 gift card. And then the last box, you can see our eligible members ages 9 to 12. There's roughly 19,868 members. And that gift card is $25, and they're eligible to get a Walmart, Amazon, or Target gift card. Usually they will choose which card they prefer. Next slide, please. In our vaccine mailing, those go out to those who have not received their vaccination. So members 9 to 12 will get a mailer, and that mailer is going to be consisting of a cover letter, which gives some general information about the gift card. And then included in that is also a American Cancer Society health education flyer. You can see there's a photo of it right here, protecting our children from HPV cancers. And then they will also receive the incentive form, which has the HPV vaccine incentive on there. That's what they will take with them to the doctor's office. They'll fill it out. And then they can, if their provider offers the gift card at point of care, they can get their gift card then, or they can mail, fax, or email this form back to Gold Coast Health Plan, and then we'll process the form and then mail them their gift card. So these are all included in the monthly mailers, and it goes out to members during their birthday month. For those that have birthdays in November and December, they actually receive theirs in October to allow for access and time to get those appointments and get scheduled and seen, and then be able to return the form. So they get their incentive form through the mailers, and then it's also available on the Gold Coast Health Plan website. Next slide. So this is the number of gift cards that were awarded for the HPV vaccine in 2024, so January through December of 2024. So those that mailed in their forms, the in-house, we received a total of 471. For those that received their gift card at point of care, there were 670, bringing it to a total of 1,141 incentives that were awarded for those that received the HPV vaccine. And next slide. This slide's going into some disparity analyses done for those members that returned their form in-house. It goes over the gender, the language, members by age 9 to 13, ethnicity, and by race, which gives us a good view of those members and, some of their background and who's returning those forms. And then on the next slide, it goes over the disparity analyses for those that receive their gift card at point of care. And it goes over the same ones, the gender, language, age, ethnicity, and race, which if you toggle back and forth, it's actually very similar for both. Next slide, please. So some of the findings of the disparity analysis, there was no disparity found between males and females receiving the service and getting the gift card. It's almost an even split, which indicates that the longstanding belief by patients that the HPV vaccine does not need to be administered to males is no longer a barrier in care. Another finding is the disparity analysis data revealed that members who are either Spanish speaking, Hispanic, Latino, identified with 2 or more races were significantly more likely to complete the service and receive the gift card. Some possible causes for that disparity, Spanish speaking, Hispanic, Latinx members were more trusting of medical professional vaccine recommendations. Vaccine hesitancy that can lead to starting the HPV series late or not receiving the vaccine at all, and general lack of education about the vaccine. Next slide. Some more findings. The disparity data revealed that members who were 12 years of age were significantly more likely to complete the service and to receive the gift card. Possible causes for disparity: historic vaccination recommendation indicating starting the series at age 11 or 12. Vaccine hesitancy that can lead to starting the HPV series late or not receiving that vaccination at all. And also the stigma around the HPV vaccine being only for those that were sexually active or older. And then the last bullet kind of goes over some possible interventions, create targeted educational outreach to disparate populations through mail or through text, implement provider education at the clinic level for inclusion in the member incentive program materials and outreach. And also education should emphasize the reasons for getting the vaccine, and not that it's just for those that are sexually active. And it's important to start the series at age 9 rather than later in that group. And then on the next slide, we'll be going over the vaccine improvement strategies, and I will turn that back over to April. Thank you.
Okay, so another strategy that Gold Coast uses is we have a quality incentive provider program called QIPP. And this pay-for-performance incentive program includes 95% of Gold Coast Health Plan providers. All 18 MCAS measures held to MPL are included in the QIPP program, including the IMA. Performance reports are sent monthly to QIPP participants, which includes the IMA performance. The program methodology includes payment for completing integration of operational activities, data sharing, and achievement of quality metrics. There's monthly operation meetings are held between GCHP and QIPP participants to review the data. And then the QIPP program uses the NCQA 50th, 70th, and 90th percentile as benchmarks as targets. Next slide. So last year we partnered with Inovalon, which is our data vendor, on a HPV vaccine adherence program mailing. the materials that were sent out were a cover letter, health education flyer, and member incentive flyer. The time frame was between May and November of 2024. The target population was 9 to 13-year-olds with an HPV vaccine gap. The outreach group total members was 15,733, and the total control members were 1,143. And so the results of the outreach group members vaccinated was 2,998. And then the rate of vaccination was a little over 19%. And then with the control group, members vaccinated were 61, and the rate of vaccination was 5.34%. So this is our last slide. It's just kind of going over, what we're continuing to do. What's our plan? So Gold Coast will continue to offer the HPV member incentive and QIPP this year, and then we have also joined the American Cancer Society HPV Vaccine 2-year learning collaborative. And then lastly, this is looking at our preliminary measurement year 2024 rates again. So we are currently at the 75th percentile with a score of 47.29%. And then our HPV vaccine rate is at 44.97%. And you can again see the meningococcal and Tdap at a much higher rate. And that's all we had.
Awesome. Thank you so much, April and Kayla. Now we're going to open it up to questions. And it looks like we have one in the chat. What are the denominators of the test and control groups for the Inovalon mailing? And are those materials tested in the mailing able to be shared with this group?
I can go back and see. I wasn't directly involved in that project, but I can go back and get an answer to see if I could share those materials. I don't see why not. And I believe the denominator was just the outreach, the total members who were outreached to. So there was almost 17,000 members total. Thanks, Cassidy.
Any other questions? You can drop your questions in the chat, or you can just come off mute if you want to ask a question for April and Kayla.
Hi, I have a question.
Yes.
This is Raquel. Sorry, I'm trying to come off mute. Hi, from the American Cancer Society, and I'm excited to be the one working with Gold Coast on the their joining of the American Cancer Society's HPV Vaccination Learning Collaborative. I was excited to learn more about the incentives that you guys are doing, and I'm sure we'll be talking more about that. But a question which I have is, did the providers offering the point of care incentive, did they if it was just like a normal recommendation that they're making of the vaccine for somebody that's eligible, were they mentioning the incentive at that point? I'm just wondering how that works in practice. Are they kind of making a standard recommendation and then, oh yeah, and FYI, here's a flyer from Gold Coast, and then how also could they be sure that they were a Gold Coast member? Can you just speak a little bit to how that point of care incentive works?
Yeah, so I guess we're not totally sure when they're promoting the incentive to the members. We do know that they, as much as they can remember, so we have all of our ambulatory clinics that are under our 3 large health systems offer point of care gift cards, and they mainly do well care and cervical cancer screening. So not all of them are doing the HPV. So I think that there may be more conscious effort around them promoting the well care and cervical cancer screening, since that's kind of the main incentives that they're doing, and it's kind of more sparsed out with HPV. But I know that the staff, they try to, whenever they're doing outreach scheduling, they're the clinics are trying to train the staff to be including that promotion of the incentive in their outreach efforts. But they're not really providing us total data on that of when it's, but that's what we advise for them to do as well. Any text messaging, any member portal, we tell them to let the member know that they'll get a gift card when they come in. So if they get a WellCare, if they're getting their HPV at a WellCare visit, they could walk away with $50 because it's $25 for the WellCare and then $25 for the HPV. So yeah.
Thank you.
Any other questions? Feel free to take yourself off of mute or drop a question in the chat. Looks like we have another in the chat. Are providers incentivized for reaching the 50th percentile regardless of where patients receive their HPV vaccine? So for example, Walgreens instead of their PCP.
I guess that, in the end, it's based on their rate. And so if the patient's getting their vaccine somewhere else, but they're still, a member under their network or under their clinic, then they would get credit for that, so to speak.
Mm-hmm.
So yeah. Mm-hmm.
Any other questions for April or Kayla? Okay, so this is also, our session goes to 12:45. So at this time, if anyone else has anything that they want to share, that their health system may be doing, any announcements or any other questions folks want to raise, this is the forum to do it. So please take yourself off a chat or drop anything in the chat. Or I'm sorry, take yourself off of mute or drop anything in the chat if you do have anything that you want to share.
Hi, hello. My name is Quý. We are from Region 2, a regional contractor with EWC program, and we're having problem logging into the webinar today, and just want to bring up the issue.
Yes, thank you. We have had several folks who had troubles logging on, including our presenters, and that's why they were on their phone. We're not sure of what the issue was, but we are aware, so thank you very much. And we will make sure that we get this rectified for our next session. Thank you for bringing that up.
And all right, thank you.
We have it recorded, so we'll make it available on our website as well, the recording.
Thank you, Julie.
Thank you.
It looks like Raquel has some ACS opportunities to share. Raquel, you can go ahead.
Okay, can you see? Hold on, let me go to the right view here.
Yes, we can
Are you able
see.
to see the Promising Practice series?
Yes, we see
Okay.
your presenter view.
Oh, the presenter view, really? Like you can see the notes?
It just shows like, where the next slide, we can see the small next slide next to
Oh.
it, that one.
Can you still see the slide?
Yeah, we can see it.
Okay.
Yeah, go
Okay,
ahead.
sorry about that. That's strange.
That's
It must be because I have my second monitor plugged in. But okay, so a couple of upcoming National American Cancer Society opportunities related to HPV vaccination. Bear with me because they've got similar names. But this first one is the most general in nature. It's our 2025 HPV vaccination promising practice series. This is something that was done last year as well. I think last year we called it best practice series, but this is kind of a come one, come all for stakeholders working on advancing HPV immunization. It's done in collaboration with the National HPV Vaccination Roundtable. And you can see the topics. The first one has taken place already, but happy to offer the recording. And then the subsequent sessions, the next one being in June, are really focusing on interventions and system intervention deep dive, and then provider interventions and patient interventions that have been either best practices or fall into the category of promising practices for advancing HPV immunization. So this is a great thing for anyone on the call that's interested in this topic to participate in. And then if you've got provider networks or other interested parties, it would be an opportunity that you can promote to them. So I can certainly provide this flyer as a follow-up. And then there's our 2025 Rural HPV Vaccination Learning Community. So this is a little different. It's just more specific. This is for anyone that's got a role to play in advancing HPV vaccination in a rural setting. So it has a bit of a quality improvement focus. So it is geared more to those that are working in clinical settings, but again, applicable for those that are partners of those in the healthcare delivery system as well. And then it is monthly. And it is, even though it started in March, it's ongoing. And there's, like a great landing page that has ongoing resources added to it, as well as session recordings. And this is also kind of a drop-in, come one, come all, essentially a webinar series, but also gives guidance for really setting up and being able to carry out quality improvement efforts to advance HPV vaccination. So I'm going in order of like general to more specific or more like registration required, because this last one is a little more specific. So this is a health system learning community that is for those in the primary care setting. So for federally qualified health centers, community health centers, lookalikes, also just primary care practices that are not FQHCs as well. And it is limited to those in the big 12 states, as we call them. So the 12 states with the largest adolescent populations, of which California is, of course, included. And this is something that there's actually an information session on next week on April 25th. So you can, pull out your phone and scan that QR code if you'd like to register for that information session. But this is going to be an initiative that there is just a minor application for, as well as a requirement to do a 6-month action plan and submit some baseline and end of project data to the American Cancer Society. But it won't be a heavy lift. It's definitely not designed to be a barrier to participation, just a way to have it be a slightly more formal engagement that health systems are participating in for the year. So there's again an information session on this one happening next week. It's a really great opportunity to essentially get some support from American Cancer Society nationally, and then from the other participants, clinics and different health systems across the country that are looking to advance their HPV vaccination rates. Thank you. Happy to take questions on any of those.
Raquel, we did get a question about, you can drop links in the chat, but I will also, I also got a request to drop a flyer for the announcement approach training in the chat, but I don't know if we're able to with the permissions on this Zoom. So what I'm going to do is just send a follow-up in my email list that you all should be on, if you're not on my email list, go ahead and drop your name, your email in the chat. And then Raquel, I can send those over. If you send them over to me, I'll send them along with the flyer for the announcement approach training.
Yeah.
Everyone on that email.
Yeah,
list.
I actually have one flyer that summarizes them all, which is kind of nice, specifying like who the audience is for each one. So it should be a good thing to be able to also share with others that you might know, including, you know, providers, because it does specify, and so someone can sort of self-select.
Great. All right, and I got that email. Joyce, can you, yeah, there we go. Here are the rest of the dates for the rest of the year. We'll be meeting again on July 16th and again on October 15th. And if you would like to showcase any of the work that you're doing to increase HPV vaccination in your health systems, just send an email to me and we can get you scheduled to present for one of these sessions. Thank you so much for joining us today. There's our website there, CAHPVroundtable.org. If you have any questions, you can also send them to our email there, or just send them to me directly for those of you who have my email from the list that I send out. All right. Thank you again for joining. Before you log off, Joyce is going to drop the evaluation in the chat, and we'd appreciate if you could complete that evaluation for us. There we go. All right, everyone. Well, thank you so much, and apologies for all of the technical difficulties. We will get that fixed. We'll get this recording on our website. And April and Kayla, thank you again for joining and presenting for today's session for the California HPV Vaccination Learning Collaborative. Have a good rest of your day, everyone.